As part of the Ministry of Public Health's mandate and in accordance with the Constitution, the Tobacco Control Council has been established.
The newly launched council consists of 10 members. Minister of Public Health Valda Lawrence had some advice for the council.
Being on this council will give you an insight in a very in-depth way in terms of why the government, and more particularly the Ministry of Public Health, is taking such a stance on tobacco.
Member of the council and attorney at law, Cassandra Alves, cited the need for governments to control the tobacco industry.
What we call Article 5.3 provisions. Article 5.3 is an article in the WHO Framework Convention on Tobacco Control that requires that the government protect tobacco control policies and laws from tobacco industry interference. And we experienced a lot of this interference. I gave you a little highlight of the day when we were trying to pass the bill, but this interference started way back in 2011. While we were holding consultations, they also held consultations, invited the medical community, tried to debunk the scientific evidence that has proven that smoking is bad for your health. And, they tried to lobby members of parliament, try to sway them so that they wouldn't vote in favor of tobacco control. So we've had tobacco industry interference throughout this process. And so we have very strong Article 5.3 provisions in the Act that requires that, if you have a conflict of interest, you can't be involved in tobacco control.
Guyana is currently on the list with 5 other Caribbean countries that has managed to have tobacco control and regulations. According to Act 17, Part 3 in the Constitution, the role of the Tobacco Control Council is to advise the minister on matters related to tobacco control and the administration and enforcement of this act.
Now we need qualified human and other resources for implementation, whether we train the staff that we have, whether we hire people to deal specifically with tobacco control, but human and financial resources are an issue. We need to train our enforcement officers, that's the police, customs, our health inspectors, our officers in the Bureau of Standards, our occupational safety and health authority workers, our EPA workers, everybody that the Act, so in the Act, these persons are specified as enforcement officers.
For InfoHub, Kippany Jordan.